All right, good afternoon, everyone. I am Congresswoman Jennifer McClellan, and I have the privilege and honor of representing Virginia's 4th Congressional District. I wanted to thank you all for joining us as we discuss the state of maternal and infant health in the United States. As you will hear, we are in the midst of a public health crisis with over 380,000 babies who were born preterm in the past year, one of the highest rates of any high-income nation in the world. That's why we're gathered here today to bring awareness to this pressing issue and to highlight a recent bipartisan resolution that I am proud to lead to designate November as Prematurity Awareness Month. Our bipartisan resolution, co-led by Congresswomen Jennifer Kiggins, Robin Kelly, and Anna Eshoo, promotes awareness of the maternal and infant health crisis in our nation and encourages parents and communities to support and leverage preterm birth prevention programs. Today, we have 28 members of Congress who are co-sponsoring this resolution, and that number is growing daily. We encourage our colleagues on both sides of the aisle to support this common sense resolution as we continue our efforts to raise the alarm and take immediate steps to improve public health outcomes for mothers and babies across the nation. I'm a mother who almost died giving birth to a preemie baby. This issue is therefore personal to me. It's an issue that impacts the lives of hundreds of thousands of expectant families every year, and it is clear that we must do more to address it. I am grateful to be joined today by Emily Greenlee, a preemie mother, Dr. Elizabeth Chereau, President and CEO of the March of Dimes, and Representatives Morgan McGarvey, a dad to 2 children born premature, and Robin Kelly, Chair of the Congressional Black Caucus Health Brain Trust. Emily Greenlee is a military veteran and mother of 3 children from Haymarket, Virginia. In 2020, Emily and Michael Greenlee's youngest child, Lois, was born preterm at 24 weeks. The Greenlees live in an area with low access to maternity healthcare services, and Emily is here to share how the family navigated the challenges of Lois's early birth. Emily?
Sorry, I didn't get unmuted. Yes, my daughter unfortunately was born at 24 weeks, and it was very difficult. I developed an infection in my amniotic fluid somehow, and that pushed my body to try to discontinue the pregnancy, try to get the baby out. So we had to travel an hour, and DC traffic sometimes more than an hour to get to Inova Fairfax from our more rural area every day. And she was in the NICU for 5 months. So we drove, sometimes I went twice a day because I was pumping for her. And it was difficult. It was very difficult. COVID made it a little easier because less people were on the road at times. However, just the situation, no matter what, it was difficult to go through. She was my 3rd child, and I just couldn't even fathom that something like this could even happen. They told me when I got to the hospital, since I was at 23 weeks, I hadn't hit that 24-week mark, that legally they didn't have to do anything because she wasn't considered viable until you hit 24 weeks. And so that was very difficult, but they were very open, like, it's all up to you. Whatever you want to do is what we will do for you. And so I chose, let's just do everything we can and see how it goes. My very first child was post dates and ended up with a birth injury due to mismanagement of labor, and he has cerebral palsy. And so the risk and the reality of something serious happening was very real to me. I already lived it every day. So I thought that everything bad that could happen was going to happen, but it didn't. I don't know how. She is 3 years old now. She's doing very well. No lifelong complications are noticeable at this point. But yes, it was very difficult. I went there every day. I did have support with March of Dimes. The breastfeeding help was also helpful because since she was so early, if I didn't give her milk, they would have to use donor milk because that's how premature her intestines, everything was. So that was very important. And that was very difficult without having, having already had 2 children, just only pumping and not having any contact with your child. It's very hard to pump when you can't even touch your baby. So that, it was very difficult. I'm sorry, I got thinking about it still gets me a little emotional. If there's something else specific that you have a question about, I'm happy to answer. But overall, it was 5 months of driving. I would go frequently, twice a day. My husband would go once a day. We just thought it was important, and we made her a promise we'd see her every day. And so that's what we did.
Thank you, Emily, for sharing your personal story. It is very inspiring, and I'm grateful to have your voice at the table. We need to be sure that more voices of preemie parents are at the table as we are working on maternal and infant health policies. And so thank you for joining us today. And we're going to take questions for the end, but I now want to invite Dr. Elizabeth Giroux to share her insights and key findings from the March 2023 March of Dimes, the 2023 March of Dimes report card.
Good afternoon. I'm Dr. Giroux. I'm president and CEO of the March of Dimes. Thank you, Congresswoman McClellan, for the invitation to speak here today about the March of Dimes 2023 report card findings released earlier this month. It is a report card. It's a report card of the maternal and infant health space. So I'm excited that we do this on a regular basis, and it does give us a benchmark of where we are. But first, I would like to express gratitude to Representative McClellan and Kiggins for their leadership in introducing the resolution to designate November as Prematurity Awareness Month. It's instrumental in raising awareness of the all too forgotten stories like Emily's. That is the crisis levels we are at in our nation. So we thank them and all the lawmakers who have co-sponsored the resolution. Prematurity Awareness Month was created by the March of Dimes nearly 20 years ago to focus attention on the impact premature birth has on babies and families and on ways to reduce preterm birth. This year's report dives even deeper into key indicators for preterm birth and explores both maternal and infant mortality rates to paint a full picture of the state of maternal and infant health today. And the report card affirms that the U.S. is not doing enough to prioritize maternal and infant health. So our grade in 2023 is a D+. With a modest 1% improvement in preterm birth, the U.S. remains at a D+ for a second consecutive year, with data showing persistent and compounding gaps in health equity that puts moms and babies at risk. In 2022, over 380,000 babies were born premature, 10.4% of all births, just a slight reduction from last year's all-time high of 10.5. So to put that in real terms, 1 in 10 babies is born premature. So disparities in preterm birth among Black, Hispanic, American Indian, Alaskan Native families, rates of preterm birth are significantly higher than the overall rate, and the disparity continues to worsen. Chronic conditions have emerged as a leading indicator for preterm birth. 30% of women have one or more pre-existing health condition before pregnancy. These are even worse in Black, Hispanic, American Indian, and American Native families. Disparities in infant mortality. The report card pulls the infant mortality data from 2021, showing a 10% drop over the last decade to 5.4 deaths per 1,000 live births. However, ahead of this report card, the CDC released new provisional data from 2022 that shows the largest percentage increase, 3% higher than in 2021, in infant mortality in more than 2 decades. With maternal mortality on the rise, gaps in health equity are putting Black and American Indian, Alaskan Native women and families at greater risk. Since most of these deaths are preventable, it's clear we're not doing enough to make pregnancy and childbirth safe for birthing women. According to the WHO, the US currently ranks 55th among other industrialized nations for maternal mortality. As we publish this report, it's clear the state of infant and maternal health in the US remains at a crisis level. But there is some good news. Many of the factors that influence poor outcomes for moms and babies are preventable, and we can make a change through solutions if we work together to address them. So the March of Dimes champions key policy initiatives intended to close the gap, expand access, and improve outcomes for moms and babies. Some of those key initiatives are Medicaid postpartum extension, our doula legislation, our paid family and medical leave. We also, March of Dimes is also championing the reauthorization of the PREME Act, the Premature Research Expansion and Education Act for moms. We also are pushing for the reauthorization of the Preventing Maternal Deaths Act, which strengthens and expands federal support for maternal mortality review committees, because we really want to elevate this data. So thank you for having me today. Thank you for amplifying our message.
Thank you for Dr. Shiro for joining us today and sharing the results of this year's March of Dimes report card. And thank you to the March of Dimes for your invaluable efforts to help solve the maternal and infant health crisis in the United States. I now want to turn it over to my colleague from Kentucky, Congressman Morgan McGarvey.
Thank you so much, Congresswoman McClellan. Thank you to Dr. Shiro for sharing those statistics. A D+ is simply unacceptable, particularly when we are talking about women's health, when we are talking about our most fragile human beings and premature babies. We're talking about the health disparities, particularly in Black and brown women in this country. We've got to do better. Emily, thank you for sharing your story. I know how difficult that is. And you were making me relive a lot of what we went through. And thinking about this, we can talk about the statistics, but the turmoil it takes on every family that goes through this as well is significant. And I remember when we went in for our 24-week checkup, and the doctor looked at us. We had twins. It was our first pregnancy. It was fantastic. The doctor said, "Everything looks so good. Don't come back for another month." The next day, my wife called me laughing from work, and she said, "You're not going to believe this. I just peed my pants." And the next call, she called crying from the emergency room, and she said, "My water broke." And we couldn't be cared for at the hospital where we were. They didn't have a level NICU high enough for us, and we were transported to a different hospital in an ambulance. We didn't leave for 109 days. And our babies were born, fortunately, at 26 weeks, and had gotten some of the surfactant and some of the things we know help these premature babies, but they were born at 1.5 pounds and 1 pound and 15 ounces, respectively. We went through the ventilator. We went through all the pumping stories, Emily. We had to use other people's freezers. Makes me think about all the things you have to go through. But even then, right, when you're dealing with these fragile human beings, they got 1 cc of breast milk over 8 hours delivered through a hydraulic arm because they can't tolerate it. And then they had to grow. And you can't change the caloric content of breast milk. And we know with premature babies that if you're using a cow supplement, a bovine supplement to up the caloric content of that breast milk, that has terrible consequences for preemies. And we know the advantages of human fortified breast milk. So we found out about that. And in Kentucky, insurance wouldn't cover it. And so we fought and we fought and we fought to try and get your babies out of the hospital, just as any parent would do. And it makes me realize the way policy interacts with this, because when you're sleeping in a hospital chair, you say a lot of prayers and you make a lot of promises. And one of the promises I made is I said, if we ever get out of here, we're going to do something about this. I didn't know what, but we'll do something to help. And a year later, I ran for the state Senate and I passed the first insurance mandate in Kentucky history, where we mandated the coverage of human fortified breast milk for premature babies. So raising this awareness, getting people to understand what goes on, to know the humans behind these stories, the successful outcomes, and then of course, the nearly 1 million babies who die worldwide from prematurity that we can help out, is just going to be so beneficial for our families in this country, in this world. And so, Congresswoman McClellan, thank you so much for what you're doing in the March of Dimes. Thank you for what you're doing. And let's continue to raise awareness. Let's continue to fight for these kids, these moms, these parents who so need it.
Thank you, Morgan, for joining us and sharing your personal story and the work that you've already done and your support of this resolution. I now want to introduce Congresswoman Robin Kelly who is the Congressional Black Caucus's Health Brain Trust Chair. She is a fierce advocate for maternal and infant health and has served as chair of the Brain Trust since the 114th Congress and has been the CBC's primary healthcare advocate. So Robin, turn it over to you.
Thank you so much. And I'm so happy to be here with you. And I would just want to thank you for leading this critical effort. And Emma and my colleague, Morgan, thank you so much for sharing your stories. And Dr. Sherrod, I don't know how my office could do it without the March of Dimes. We work with you so closely. So thank you for all the wing beneath our wings. We appreciate you so much and look forward to working with you more. We must recognize November as Prematurity Awareness Month to bring awareness to this urgent crisis. As you know, the United States is the richest country in the world. We have made medical advancements that seemed impossible only a decade ago, yet our babies and our moms are being left behind. Premature birth is not an inevitability for so many mothers and babies. Proper care and access to treatment could make their pregnancies easier and their early life healthier. And premature births, as you've heard, disproportionately hurt Black babies. Infants born to Black mothers are more likely to be born premature, and Black infants are more likely to die before their first birthday. As chair of the CBC Health Brain Trust, I have been focused on the disparities that prevent Black families from living the happy, healthy lives they deserve. The statistics are not just numbers on a page. They represent the lives of mothers and babies that deserve better. They deserve action, not just empty promises. The United States has one of the highest infant and maternal mortality rates among our peer nations. We know that better outcomes are possible. We just need the courage to act. Congress must pass legislation like the PREME Act and send it to President Biden's desk. Again, thank you, Rep, for all of your leadership around this issue. And thank you to Emma and Morgan for sharing your stories, and Dr. Sherrod, more work to be done. Thank you so much.
Thank you, Robin, for co-leading on this bipartisan resolution and your continued efforts to promote the CBC's health priorities and address the longstanding health disparities that impact Black Americans. Before I close us out with my personal story, I want to remind the press on here that if you want to ask a question, you can use the raise hand function, and then we'll have Syed from my office call on folks. But again, as you've heard today, the state of maternal and infant health in the United States is not what it should be. It is a D. And when I was in school, a D was not acceptable. My own state of Virginia is not much better at a C, but there are localities in my district, the city of Richmond, that are an F. That is not acceptable. And the statistics are one thing, but as you've heard today, the personal stories are something else. So I was first elected to the House of Delegates in Virginia in 2005. And then in 2010 became the first member of the House of Delegates in its almost at that point 400-year history to be pregnant while in office, which opened my eyes to how policy can impact pregnancy. I then became pregnant with my second child at the age of 42. Both of my pregnancies were considered geriatric pregnancies and high risk. And with my second pregnancy, I had placenta previa. I was lucky that I had access to quality healthcare during my pregnancy, and I knew exactly what could go wrong, and I knew pretty much the worst case scenario. That didn't make it any easier. When I woke up early one morning, bleeding, and was rushed to the hospital. I knew I was going to have a cesarean section, but knowing now that I needed an emergency cesarean, because when I came in to the emergency room, hearing a doctor say, we've got to go to OR right now, as both my heart rate and my baby's heart rate dropped precipitously. The last thing I remember hearing is my doctor saying, I'm going to take care of this, and having a nurse say, look at me, don't worry. I woke up. My daughter was born, Samantha, at 31 weeks. She was a little over 4 pounds. but I didn't see her until the next day. And when I left the hospital and left her there, it was the hardest day of my life. But I have to say that the March of Dimes was there to help, helping to teach me how to do the kangaroo care so that I could have skin-to-skin contact with my daughter. Thanks to the Affordable Care Act, having the insurance pay for a hospital-grade pump for me to pump for her. And knowing, again, we were one of the lucky ones. But every time we thought we were going home and she would have a bradycardia and we'd have to start the clock for how long it would take before she could go home again, broke my heart a little bit. Fortunately, we were able to go home, but we worried about whether she would develop, meet all of her developmental milestones. And thanks to the insurance laws in Virginia and the Medicaid laws that provided early intervention services to watch her development, again, we were among the lucky, but not everyone that was in that NICU with us was so lucky. I want to thank, in the last Congress and earlier this year, I'm thankful that the Pregnant Worker Fairness Act took effect to help some mothers who have high-risk pregnancies can take care of themselves, have accommodations, and not have to worry about if they need to choose between their job and a healthy pregnancy. But we've got more work to do, as you've heard. And so we are here today to raise awareness about the causes and the risks of preterm birth, some of the policies that can help prevent it, and some of the policies that can help with interventions to ensure that all babies that are born preterm have a better chance of having the lucky outcomes that the ones that you heard about today had. And so again, I want to thank everyone for joining us today, and we're happy to take any questions that you have.
Again, just a reminder, you can use the raise hand function if you have a question. We'll just give it one moment, and if not, we will let everybody go. Okay, seeing none, I'll turn it back to you, Congresswoman.
All right, well, again, thank you to all of our speakers, to everyone who has signed on to this resolution, and again, to the March of Dimes for all of your work to ensure that we reduce the preterm birth rate. Thank you all for coming.